here.
said really fast so you don't even catch it.
Yeah. Yes.
So that's a biggie. And if you're stressed, if you're over 40 or 50 years old, chances are you're not making as much acid as
Well,
you
and we
used to.
didn't even touch on hormones.
Right, and then there's hormones, bioidentical hormones. For men, it's testosterone. For women, it's estrogen.
You mean men get osteoporosis too?
Yeah, men
Oh
get
my
osteoporosis.
gosh.
I mean, don't you look? You see these old guys.
Hunched over.
Well, we're pretty old too. Yeah,
Yeah, we are.
Hunched over. Well, we're not hunched over. You know, we're
No,
we're taking
upstate,
we're
yeah.
taking our hormones and everything else.
Yes.
But they're hunched over. They, you could look at that person and say, "Yep, that guy's got no testosterone probably for decades, and so he's developing osteoporosis."
Sure.
But stay tuned. We're going to talk about that
can talk about
in
hormones.
another video.
So another thing I wanted to touch on too is some of the other micronutrients that a lot of people don't hear about. Strontium is one of them, and like we sell a
Strontium's
product
a really
called
good
strontium citrate. And so
It's
touch
not
on that for a
It's
minute.
not radioactive, by the way.
Not
So
radioactive
if
strontium.
you hear
Okay.
strontium, it's
Yeah.
not. It's the good strontium.
Okay, good.
It's really good for reversing osteoporosis. Most people are low in it. The only thing about strontium that I would say is that you have to take it separately from other supplements. So they usually will keep it, like as a separate supplement, so that you do that on purpose. They won't add it in with calcium and things like that.
Right, I don't see that. The nice thing back to vitamin D is that if you don't want to take a capsule form of it, a lot of companies do make like a sublingual drop. So it can be one less pill, so to speak, to take and just put a drop under your tongue and something like this. Doses of vitamin D that you typically would have a person, I know we can run blood levels and see, but if a person just says, how much should I take?
Well, then consult your doctor.
That's
I was
right.
going to say that.
Yes.
But when I see my patients, I'll have them take anywhere from 3 to 10,000 milligrams a day.
And in a drop form, that's really easy. This is 2,000 per drop.
Yeah.
So.
And it just depends on what your levels come back at.
Sure.
Your doctor should be testing your levels.
Yeah, that's great. Any other things that you wanted to talk about for bone health?
Well, the other thing that's important for bone health is your growth hormone levels. Okay, and you're saying, well, I don't need to grow anymore. I'm so many years old, but it should be really called repair hormone, because growth hormone is repair hormone. It can reverse osteoporosis, and there's a lot of different ways of trying to increase growth hormone. One way is to actually take deer antler. And PRL, Premier Research Lab, and Mike's got it here at the pharmacy. It's called NZ Deer Antler. It's from New Zealand, and you take 1 or 2 at night, and it's a great way to try to help improve, reverse osteoporosis.
Right, that's awesome. Remember, this little video is not meant to get between you and your physician.
Oh, no,
All of
we
these
would
things are
never do
really
that.
important
Oh,
to
my goodness.
see your physician before. We're not recommending anything that's going to treat you medically that you should be working with your physician on. So, again, thanks, Dr. Tabuzian, for being with us
you're
today.
welcome. Glad to be here.
Stay healthy, my friends.